My name is Wendy Brewster, and I was discharged from the teaching hospital on Sunday night with instructions. I have to see two specialists, Dr. Coombs and Dr. Tilakdari. PETROTRIN sent me there after results of blood tests. Firstly, PETROTRIN refused to send my medical documents to San Fernando Hospital no matter how many times the doctors asked for it so they could treat me properly, and I wasn't being treated to the best that I could because of that. They gave me these letters, which is photocopies I have to go. They gave me a letter sealed, and I opened it, and when I opened the letter I saw the information that the doctors had asked for in the San Fernando Hospital, and I carried it for them. This is the document of the lab report showing that my liver GGT level is a high level of that of a smoker and a drinker, heavy alcoholic use. When I did the research, the lab report states that my liver reading normal is between 10 to 47 UL, and my own GGT is 79.0. And there are other medical factors that are not going to go on camera, which are several. When I did the research on the GGT, I'm having all the symptoms. They also lied to me. 3 doctors only who I trust, and I'm going to say it publicly. Dr. Danraj, Dr. Jones, and Dr. Jackson have been the only 3 PETROTRIN doctors who have been truthful to me about my condition. Because when I looked into the report also, Dr. Danraj treated me for an infection. And the length of time I have been treated by PETROTRIN Hospital, no other doctor that I saw before him never told me. And the results mark recurrent ear infections. My daughter, pressure right now, I have to read it because I don't remember sometimes. Her blood pressure this morning at 6:47 a.m. was 103/55, and her pulse was 56. Now her blood pressure is 103/47, and her pulse is 60. My sugar this morning was 341. I am now using insulin 3 times a day. The doctor, I have contacted Miss Friday through the phone, through her secretary, several times since the 15th of August to tell her about my situation. I wrote 2 letters to PETROTRIN since the 15th and the 19th of August, and they never responded because I am a writer, and I wrote a poetry named Oil Spill, and I posted it to their wall. I also, every time the rain fall, which was every 2 days at a time, during the time that I inhaled the oil, from since the major oil spill until now, up to yesterday, oil was smelling on the river, and my daughter went Marabella for the day, but she has no sense of smell now, and she came home very ill. My husband fell ill yesterday when he went to work, and the doctor sent him home, but I will not be saying his name on camera for my reasons, right? And he is ill. I don't know if he went to work, but he couldn't come down here because he said he would feel worse with the air condition. I have to be in air condition all the time, most of the time, due to the smells. I pick up smells very easy. I'm allergic to most chemicals. 3 chemicals I'm not allergic to are the Lysol, Discipline, and I can't remember the next one, but I'm allergic even to the wipes that I need to take my injection when I'm using the insulin. The only person helping me is my goddaughter that lives next door. She gives me insulin. She cleans me. The house is not clean here yet because water fell and the electrical equipment was on the ground, and I had to hold my daughter this morning on the mat, and the mat was wet, and I caught cramp here, and I called 999 to ask if the fire service would come and unplug the equipment for me. PETROTRIN has put me in many embarrassing situations since this oil spill because Roy Joseph Health Center personnel refused to attend to me because my card was marked Marabella, even though I tried to explain. And they were telling me to go to the lung therapy thing down by the bowl, and was one set of nonsense. And a friend took me to the pharmacy and bought medication for me instead. Pleasantville gave me a card, but I didn't have transport. When PETROTRIN called me before I went to the hospital and set up an appointment, and I waited on them whole day. I didn't eat and I didn't take medication, and I was ill for 2 days, and that caused me to be hospitalized again. Alika Leslie had surgery under her arm on the 26th of August. And the boil has started to go back under the same place under the arm, and it is hurting under her arm. She has severe headaches too. 3 of us tested badly with the lung function test, and we got different types of nebulizers. You see in an orange one anywhere there. My son has a one with a mask to put on his face in case he goes into distress. So he had to use it lunchtime after he ate. Now I have a problem with the Ministry of Education. I have nothing to lose, so I'm saying everything. Several times my children will refuse breakfast and lunch because I am a prison officer. And when I told the teacher, but I'm in hospital right now, when I was talking to her, she said, but ain't NIS let's see about that. I said, that is not the way it works, and you know that. She started to tell me something else that annoyed me, and I said, ma'am, tell Ministry of Education to talk to PETROTRIN and do not allow me to be in this position, right, that I cannot afford to give my children a lunch to send them to school. So as of today, they will not be attending school. Because as a young person, I taught kindergarten, and my children never went to kindergarten. My son missed 40 days in a term because of my ill health, and he was still at the top percentile in his class. They are very bright children. And my daughter is a marathon runner, as well as my other children who are being subjected to this oil that is making all of us sick, and 200 plus residents. The night I fell ill, a pregnant lady was ill, and the committee members saw the ambulance by my house, and they called 2 PETROTRIN ambulance also. And they stopped to see what the matter was, and I was taken to the hospital. That is the second time I was hospitalized, and my children were taken by the PETROTRIN ambulance to the San Fernando hospital because this daughter here called the wrong ambulance by mistake. I wasn't aware when I reached there, but they told me I had a high fever, and the consultant advised my husband not to transfer me to PETROTRIN, let me take the treatment, because in the chest x-ray it showed acute pneumonia, lung infection. in about a week time, they were able to treat it that half of the lung was clear, but the needles, the IV they keep not being able to find veins for days on end on my hand because my immune system is shut. My immune system has been weakened over a period of time, even before the major oil spill. We used to be smelling the river and we didn't know the true danger until this happened, and my son put me on and my friends put me on places from Facebook where I can go and get the information. They said I did not have benzene poisoning, and when I look in the report, this lab report has the information in it that they're testing me for benzene poisoning and they are sending it away. They tested me for mycoplasma, which I haven't looked up as yet, and Legionella, and allergic rhinitis. And I don't know who this doctor is. I tried to call him. He is on the report. I tried and I never got through to him because I don't know if he was with patients or what. When I was warded, I couldn't breathe for a long while, and they put this down my throat to try to get me to breathe, and it stifled me instead. I smelled polish from a distance on the ward because they keep there very clean, and I want to say that the nurses they call it the Hyatt, it is really the Hyatt. The nurses of San Fernando Teaching Hospital and the doctors have been fighting for my life where it is not their fault. And as I find they are underpaid for the job they did. One nurse saved my life. The night I went into distress inhaling the polish, they had to call the doctor, and the doctor was in the old hospital in theater. And the nurses had to try to get me to breathe because I inhaled the polish. And when substances mix up with the warm air, it's worse for me. So they told me get an air conditioned unit, and this is what I have temporarily set up here. But it is unplugged because of the danger of the electricity, and the place is wet right now. PETROTRIN never listens when you call them for transport. They leave. They have left me 2 and 3 days on end. When I ask to speak to the doctors who I trust, the person promises, and I never get to speak to them. Recurrent means over and over, and that means I had the ear infection long before I was made aware, and it was only certain particular doctors telling the truth. That night, the nurse tried to put a tongue depressor in my mouth. It didn't work. They put this down my throat, and I started to be in worse distress. And they cut my clothes, and they put the monitor on the heart, the ECG, and something went wrong with the pulse or the beat of my heart, and they put the bed up, and they kept me up. And a nurse started to blow on my face and say, blow, breathe, Wendy, breathe. And that is the first time I was able to gasp for air. Talking too fast. And they kept me up for the night, and they monitored me constantly since then. They have worked very hard. The place is very clean, but that is what I cannot stand. Every time I go into the toilet to use the toilet, I smell all the chemicals. And I wheeze, and they have to nebulize me after. My potassium is so low because they cannot get the IV works for 2 or 3 days, and then it rejects. One of the nights, I bled on my book when it rejected it. On my books that were on my bed, the nurses had to change my sheets because blood was all over on the bed. My pressure was low, and I was sleeping, and the IV came out. It rejected again. PETROTRIN is saying that they are relocating people and they gave people water and food. They took 4 days to come and even tell us there was an oil spill. We ate contaminated food, drank contaminated milk and water since the Wednesday. No alarm was sounded. The Saturday they came and said they sounded the last 2 of my children. These are the 2 letters that I wrote them. I could read part of it quickly. I am writing to express my disappointment at the disregard that PETROTRIN officials have shown for my family. I'm only reading parts of it. A few days after the acknowledgement of the oil spill, same officials came to our residence. They were aware of the severity of the situation and that we were next door to where PETROTRIN was extracting the oil from the river. The nauseating smell was constant. They experienced and commented about the stifling stench and asked if we had somewhere to go otherwise. I informed them that our family was large, 9, and we had no one who we knew could accommodate us. One doctor took his stethoscope, put it on the back of one of the 2 younger children, deemed their lungs were clear, told us to drink plenty juice and water, they then proceeded to leave. During the time that the oil continued to be extracted out of the river, no official came to offer assistance of any kind to my family of 7 children and 2 parents. The Sunday following the visit, everyone in the household was ill with diarrhea, burning of the eyes, face, itching of the scalp and skin. My son was also vomiting. Discoloration around the mouth. 3 of my daughters got boiled under the armpit. One got discoloration on her back and face. We were limited because we were sick for days, headaches and ill health. Clothing that was washed in the pavement to be discarded. No official came to see how we were managing. The neighbor gave me the information of a hotline number, and some of my children were attended to at the Augustus Long Hospital, but the assistance there was limited and we had to seek medical attention privately at the Marabella Health Center. Here I told them also about this is the 15th, and this one I just read is the 19th of August. I called Miss Friday's secretary somewhere in between that time, and I told them about the negative thing, how I had to use money for grocery and school supplies to attend to medical needs, causing to diminish and not being able to purchase. And it was disregarded because I write every time the rain falls that the river smells, and I wrote several poetry since then. Oil spill, a black man's rage, these rough waters. I used to do monologues, and I did for the woman in prison. This is a soca chutney monologue that the prisoners wrote, and that they put a soca beat on the radio station of the prison. I forget the name of the station, and I did the monologue, right? But I can't play it now because I can't plug in anything, right? And I did several pieces when I feel depressed or anything, I write. The doctor also advised me to speak to a psychologist because when things like that happen all of a sudden, it is a good thing because I'm having some wrought, angry thoughts. Because all my children have to be living in this 1-bedroom apartment, and my son refuses to leave Marabella due to that, and due to the fact that he don't want to go by nobody and be using their toilet every minute. And I'm sure he's very ill this morning and cannot go to work also because he tested bad in the lung function and his work is threatening to terminate his employment. My son is very bright. He has 8 O-levels and 4 A-levels. He's 21 years of age, but he's a smoker. And therefore, according to the research that I did, which he helped me to do, it is more dangerous when people smoke. The Dr. Jones told him that and spoke to him about his smoking, right? And for him to stop, but he's somebody I have to deal with him in a different manner because he's stubborn like I am, right? And those are, as I said, those are the only 3 doctors I trust their word, because I went to several doctors before and they never explained to me certain things that I am seeing in these tests. And I need to say nothing else because the lawyer that my husband attained for us, I have to discuss everything with him from now on. So I have to be careful also what information I give out, but all the information is in black and white and it is sent copies. So, Zalika, where you going? No, you're not. No. No, that is the oldest one who had the surgery, and she is ill. Your pressure is low. Right? It's written here. I have sugar readings, and I test my children pressure and sugar, and I write it down. And because of the refusal to grant them lunch in school, there's a lady who cooks for me, and she will be bringing lunch for me. My goddaughter helps me. She will be cleaning here up because I cannot do it. I cannot walk properly as yet. I have a walker downstairs to help with my therapy, which starts Friday. Next week, no, Friday coming, because when I was hospitalized, it had to be put off. The work is going to medically board me automatically, but the work, the prison service is assisting me in whatever means they can. They have brought me insulin, and the infirmary officer has gathering some stuff because I need sheets, I need pillows, I need mattresses, because it's 5 of us will be staying here in this 1-room apartment. They need to utilize downstairs for sleeping, and my twin is staying in Gooden Street by my good friend mom, but she's an old person, so she cannot take no more children. Just the twin, when they come home from school in the night, they will be sleeping there. Finish. PETROTRIN, the common folk is morally better in their PETROTRIN is responsible for an ambulance attendant ill-treating me and not taking me seriously, my illness, because she did not understand that I couldn't communicate with her. And when my hand fell down because it was cramping in the ambulance, she said, I could say something. I fed up with this shit, yes, because she couldn't get me to raise, because right now my hand is cramping because I'm leaning on this side. When I got up this morning, my whole right side was cramping. And for hours I stayed in this water because of what happened to me for PETROTRIN. Because if PETROTRIN didn't put me in the position, the ambulance attendant would not be attending to me to be going on in that manner. When they came to me, the man alone tried to help me. My goddaughter had to help lift me up, although I couldn't walk properly. She made me walk. She said I'm making her work hard for her. And she also told the nurses that nothing serious was wrong with me. And on the ward, a stranger called until she called 4 times until she got a phone call to a friend who came to see me. And at the time she was on her way, I was going into distress. And the nurse, I got the nurse attention to see the notes. And she said, "You didn't show the ambulance attendant that?" I said, "Yes, I tried, but I was having chest pain and I was cramping." And she didn't look at it. And in those documents I had clutched in my hand was the 2 specialist letters, a heart and a COPD, they told me. specialist, and was the information. And the doctor came the same time and saw me in distress, and they put me in the resuscitation room because they were short staff was the reason that no one was around at the time. But that ambulance attendant laughed at me, and she put me in a wheelchair for hours. I called them about 11 o'clock. I can't remember the time. And that was the day before the Wali, they said. And about 4 in the morning, I stayed in a wheelchair from about, I'm not sure if it's about 12 to about 4 in the morning. I'm not sure. And my whole side was cramping. And when the doctor saw me, she wheeled me into the resuscitation room, and they gave me treatment, and my whole body started to cramp. And when they put the bed down, I couldn't breathe, so they put it up, and they gave me medication that they thought was anxiety until they saw the notes. And they started to call different doctors, and they put me on the ward, and that is when I went up to level 13, ward 10D, and I was also on level 15, ward 11, and they treated me there, but the same thing happened with the veins. So I am using figs, bananas. They given me a tablet for the potassium, and they were trying to give me it in the drips too because it was so low, but the drip stopped. It rejected, my veins rejected it again, and they told me I need to go to therapy and see the therapist, and they put me to 2 more clinics and treatment, and I just need to get transport. And I wrote a letter to my workplace, and a friend will be delivering it for me, and they said they will try the best to assist me as far as I'm concerned, not PETROTRIN. And I was also advised to do my test outside, but I don't know how that is possible. I would like the powers to be to look into this situation. 5 pregnant people lost the babies. Several people are ill with the same disease. I would like to speak to the counselor in Labre, because we are not getting assistance as we see fit from the counselors in the counselor, not in this area, because I now come back here. The one Marabella, Miss Friday, and Mr. Hassan Ali, and I don't know the name, I forget the name. They are very inefficient and ineffective. They are not helping the people. They don't care if we live or die. And the river runs right between our properties and PETROTRIN. And we are not squatters. We own our properties. And we are people who cannot work due to the spill that happens every time the rain falls. And a lot of people have the same symptoms, and I have names and phone numbers if the media wants, of several people who are ill, and some is by the lawyer. They can get their hands on it and speak to the people. Don't take my word for it. Speak to them themselves and see that is not my family alone. Next door, the people are very ill. Oil was being extracted right next door, and for 2 weeks at least the river was black with oil.
How can they contact
you? Via tree. I can be reached by my phone number 353 Just a minute. Yes, 3534792. I can be reached. I have people's numbers on this phone that, like my brother, and close friends that I can be reached on. My address now is Lawrence Street, Building 4, Apartment 2. The doctor said no circumstances, do not go back. Do my therapy, stay in air condition most of the time, get assistance, and don't take my children out of there. So I cannot wait on PETROTRIN to relocate me. I would also like the Ministry of Justice to look at the fact that they're providing safe houses for officers, and maybe they can help, although they are not responsible for this spill. I want to appeal to the moral values of people right now, because PETROTRIN has none.